I'm here with Dr. Azim Kasmani, Public Health and Preventative Medicine Resident Physician at Queen's University for, what's this, our 7th week?
I don't remember now.
That makes 2 of us. Anyway, it seems like a quiet week. I don't have a whole lot of questions for you, but I guess the big one is, what's the news?
So again, no news is good news. We haven't seen an increase in cases recently. We've been steady, and so we're quite reassured by that. We continue to work hard to prepare, though, in case there are more cases that come up, especially looking at our vulnerable populations. We've seen how this disease really affects the vulnerable populations, for example, people who live in long-term care homes, and so that's been a big focus of ours, following the province's guidelines, getting out to them and testing everyone there as a surveillance strategy, and making sure that there aren't any cases, and if there are cases, that they don't spread within those facilities where we've seen around the world, really, so many people suffer so much. So
this isn't a local question per se, but I know one of the things that this appears to be a real devil of a disease that takes on different forms. A lot was made about people in long-term care, older people being more susceptible, but we're seeing a lot of younger people getting hit too. And it almost seems like in some cases that the body becomes its own worst enemy, that our immune system almost over-attacks the disease and causes problems, and that seems to be where it is in young people. Is that your experience?
Yeah, that's what I mean, I'm not working in the ICU myself, and we haven't had that many cases, so we haven't seen it locally as much, but reading about it and looking at the experience of others in New York, in Italy, in China, that's exactly what you're saying is very true. And this is also the same for other viruses too, where sometimes there's some younger people who have an over-aggressive immune system, and it's that immune response that gets them into trouble. And so one of the treatment things that they're looking at and that they're studying in trials right now is seeing how some of those immune modulating drugs, if given at the right time, can help people survive this or not get too sick even. And so that's one of the big areas of focus as well, finding out who would benefit the most from that. And one big thing we've seen with this virus is that timing is very important. So although drug X, treatment X, whatever it may be effective, it's only effective most likely if given at the right time. And so as we see studies coming out and news releases, et cetera, from abroad about this medication works, this medication doesn't work, beyond the headline, what we do is we read into the study facts, how they went about it, critically appraise. And one of the big things I look for is when was this treatment given? So it has to be given at the right time. And we saw that in China when they gave steroids early, and steroids help bring down the immune system. They actually cause more harm. But later on in the course of disease, there may be some benefit to different treatment mechanisms. And so it's making sure that you time it right and study it so you know, so you compare it to people who didn't get that and ensure you can compare the two and that it's actually the treatment that's making the difference.
Yeah, it just seems like so much of medicine is definitely education, training, research, you know, acquiring expertise, but so much of it is a crapshoot too, it seems.
Well, I think it's more than that. I think the first factors you identified are the important ones. So using your clinical experience, your judgment, and we practice evidence-based medicine now. So we look at the evidence that's available and compare it, because oftentimes we may have biases that we don't recognize. But you're right in that we don't know who's going to become sick. And if we had a way, we might have a way of predicting it for 80% of people, but that still leaves a certain number or a certain percentage that we don't know. And so there are a lot of young people who do become very ill, And if we had a way of knowing exactly who could, then we could better manage it. But it could be any of us. So that really highlights the importance of the preventative measures we're taking.
Precisely. We have to all assume, even if there are, there are ages or there are social demographics or whatnot that are more susceptible, we have to assume that, hey, this virus doesn't care. It's going to come after you if it can, like all viruses do. It's just trying to survive.
And those factors hold true across a population level, but across an individual level, you can't predict with more specificity.
So turning back local, before we went on the air, you were mentioning that the next phase is coming in this. We seem to have leveled the curve. We seem to be perking along. I hate to use the term nicely, but we seem to be doing okay. Okay, so now we're looking at possibly reopening a little bit again. How are you preparing for that? How to make that happen safe?
Yeah, so first of all, the province has released its framework. And so we're following the guidance from the province and looking at the different factors the province has put into play that need to be in place. So making sure that if there are cases, we can stop them from becoming bigger outbreaks, making sure that we have the public health capacity to do that, making sure that our hospital partners have the healthcare capacity to treat people who come in. And when we say opening up, again, it's not just a light switch where everything's back to normal. It's a gradual dimmer and we've seen the province already, they've slowly added to the number of businesses that can be operational. And in doing so, have also ensured that there's physical distancing that continues, and that we keep using many of these very effective measures to help limit the spread. And so we need to be able to test and find those cases, which we are doing. And when they come up, we need to then be able to isolate the people who are unwell, find their contacts, and put them into quarantine so they don't spread it. And we need to be able to do that quickly. And so that's what we're doing, and finding those areas that are at high risk of outbreaks and having plans in place there. So we're working with our local partners, all of our local partners, to make sure that they have plans in place that if cases come up, they know exactly what to do within their business, their institution, whatever it may be, to stop it from becoming a much bigger outbreak.
And every individual case that you get or that you study from other jurisdictions, of course, adds to the information in this, what is really a detective game, isn't it?
Exactly. And this is the stuff we do all day, every day of the year. So this is public health and our outbreak management. If you've ever had food poisoning and gotten a call later from public health or within our sexual health clinics, this is our bread and butter work that we do all day, every day to make sure people aren't getting sick.
So I'll leave you with one last question. What did you do on Sunday when it was sunny and bright and beautiful and 23?
Well, we're lucky enough to have a patio, so we got the furniture out. We had a nice day in a little bit of sun outside, did some gardening. I had the little one who loves playing outside, so she was very excited to get out there. So that was really nice for us, and it's getting a little chilly again, but we're looking forward to the warmer weather and maybe even being able to eat outside and have dinner outside, so that'll be nice.
Oh, the barbecue. Fire up the barbecue.
Exactly.
Well, thanks, Azim. We'll touch base next week, and hopefully there's not a whole lot of news next week either.
I hope so. Take care. Thanks for having me again.
Thank you.